Welcome to the True Skin Experts Podcast, your trusted source for clear, science-backed information on skin health and beauty. Presented by American Society for Dermatologic Surgery board-certified dermatologists, the episodes break down topics from skincare to medical dermatology and cosmetic procedures, so you can feel confident in your skin health decisions. Whether you're managing a skin condition, exploring cosmetic options, or just curious about the best skincare practices, we're here to empower you with expert advice, one episode at a time. Enjoy this episode recorded live at the 2025 ASDS annual meeting, showcasing the energy and innovation that make the dermatologic surgery community and ASDS members the true skin health and beauty experts.
Welcome to the ASDS True Skin podcast series. We invite you to learn about all topics skin health and beauty. In this episode, we are going to explore Sofwave solutions for GLP-1 patients. I'm Dr. Arisa Ortiz. I'm a board-certified dermatologist in San Diego. I'm the director of laser and cosmetics at UC San Diego. And joining me today is the team from Sofwave. Would you like to introduce yourselves?
My name is Louis Scafuri. I'm the Chief Executive Officer of Sofwave.
And hi, I'm James Bartholomeusz. I'm the Chief Innovation Officer for Sofwave.
Well, welcome. We are so honored to have you today. And today our topic is GLP-1 patients. So we know that this has been really a great victory with weight loss, and patients are so happy with how they're able to manage their weight. But what we're seeing is that it also comes with a price. Patients are aging, they're ending up with loose skin, excess skin, muscle loss. So please tell me, how does Sofwave address these issues and what solutions do you have for us?
Well, first off, we see the GLP-1 phenomena as a really good thing. People are feeling better, the long-term health benefits are well established across a variety of disease states. And, from the standpoint of what Sofwave does, it was our stated goal since the beginning to have a superior, non-invasive lifting, tightening procedure, which would provide for the general public consistent, safe, reproducible results. So we think we have the ideal solution for the providers and for the patients. And it's also affecting the muscles as well. And James, do you have any comments on that?
Yeah, I think that's probably the thing that you talk to a patient that's been on GLP-1 and they don't even know that high caloric restriction,
Right.
The first thing your body's going to do is eat your muscle. It's not going to eat your fat.
Right.
And so I think making sure that you have a comprehensive solution. We've got the solution to deal with the dermal laxity, that skin laxity, but we also wanted to make sure that we had a total body solution that's going to prevent and actually increase muscle, prevent muscle loss and increase muscle and functional strength to really help these patients in a holistic manner, not just do one or two things.
Yeah, that sounds like a great comprehensive approach. So let's start with Sofwave for tightening and lifting. So I know there's been a lot in the media about fat loss with certain tightening devices. Can you address that and tell me how Sofwave avoids that? Or
Well, I mean, we've all heard the phrase Ozempic face, right? Ozempic butt, Ozempic face. And the last thing a patient needs is additional loss of fat through the treatment with an energy-based device. By design and by every measure, safety, fail-safe mechanism we put in the Sofwave device, we do not disrupt the fat or melt the fat at all. I mean, James could give you a very detailed description how we do it, but at least there are four major ways that we prevent against it.
Yeah, I think first things first, there's a lot of technology out there and it's very confusing for a lot of people.
It is.
And you hear RF, you hear RF microneedling, you hear ultrasound, and people just lump it all in together. And even in the last couple of weeks, people have been like, oh, energy-based devices, they melt your fat, they cause nerve atrophy, they do this, they do that. And it's very important to understand that each technology has different aspects to it. As Lou mentioned, Sofwave was designed specifically to only treat the dermis and to not get into the fat, because we knew that fat preservation is one of the keys to youthfulness. And it's revolumizing and restructuring the dermis, which is what's going to give you the biggest impact in laxity, resisting gravity, and giving you that skin that you had when you were 20.
Yeah,
So,
that sounds great.
Right. So everything about Sofwave was designed to do that. The frequency, the fact that we don't use focused ultrasound. We are an unfocused product. We have cooling of the skin, so we protect the skin surface. 3 times more energy is absorbed within the dermis than within any other layer of tissue. So even if you had very, very thin skin, like a millimeter thickness of skin or half a millimeter thickness of skin, by the time the ultrasound energy got to the fat layer, it would scatter and disappear, and you would get a very little temperature rise. So it's absolutely impossible for Sofwave to have an effect on the fat layer, and that is by design.
That's very reassuring, and all with no downtime. That's the best part, right? Patients can go right to lunch afterwards, and no one would ever know. So it's really easy to have done at any time.
Well, we kind of been doing this a long time, and so we've learned over the years. We had a technology, the very first microneedle radiofrequency technology, that was designed to do exactly that, to really focus on restructuring the dermis. But in that case, it was operator dependent. If the operator put the needles too deep, then you were going to get some fat atrophy, or you'd get some fibrosis in the fat. If you put them too superficial, you would get surface injury. And by design, Sofwave avoided all of those to keep the efficacy level high and got rid of those issues related to operator variance. So we have a protocol now that is literally operator independent, where we can keep a standard amount of result, a standard amount of safety, regardless of who's using the device.
So that's how Sofwave offers lifting, tightening, and how does Sofwave offer improvement in muscle atrophy?
Well, so that's a completely new technology that we just added.
Great.
And this is one of the things that we added because, again, from our customers, listening to our customers that are using Sofwave more and more on the body. We just released a body handpiece specifically to treat, arms and thighs, as an example. We wanted to make sure that we had the total solution. So the next best way that I know how to increase volume, if you've lost fat volume and muscle volume, is to increase your muscle volume. So we designed a device called Pure Impact, but instead of being like every other muscle technology that is really just, I want to get abs for summer, do 30,000 sit-ups in 30 minutes, we looked at it from the base sports physiology fundamentals, which is you need to treat the muscles exactly the way that you would treat them as if you were exercising. You need to treat multiple muscle groups simultaneously. You need to treat what we call plyometrically, which are compound muscle exercises. And if you hit all of these different points, you create a machine that is an augmentation to what you should be doing when you're at home or at the gym, that's going to amplify your results. And it's going to work on whether you're Mr. Olympia or somebody who's a little bit older, and it's going to have that can't afford to have any impact on their knees or on their elbows or things like that. So we have a zero impact, maximum muscle impact with Pure Impact for those patients across the board.
So does this replace going to the gym, or do you still have to go to the gym?
It's just an adjunct. The whole theme, the marketing campaign that we're ready to roll out is peak, not plateau. People work so hard, even though they're on GLP-1s, they're trying to look their best. And once they look great, everybody wants to look a little better. So we believe that both the Sofwave technology will enhance the laxity, revitalize and regenerate the skin in the manner that James described. And we believe that the Pure Impact as well will allow that patient not to plateau, even in their fitness routine. And as James made the point, it doesn't matter if you're Mr. Olympia or you're recovering from whatever. Sofwave is going to take you to the next level at least as good, if not better, than an elite personal trainer.
Yeah, one of the things that we found out when we did the research on these muscle devices is, first of all, these companies just repurposed devices from 65 years ago and just started selling them without any science or anything. And when you go back and you look at, science has changed a lot in 65 years. And so we were able to go back and go, what's the absolute cutting edge sports physiology right now about time under tension, the way the muscles should be moved, how you should combine muscle movement together, and more importantly, how you should never plateau. And people don't realize this, but we talk about building collagen. Collagen you can build over 10 months, right? It just, you build it 3 months, 6 months, keeps on going. Muscle's not the same.
Right.
Muscle, you'll build it over 3 to 6 weeks. And guess what? If you don't do anything else, you'll lose it in 3 to 6 weeks. So we had to build a system that people could continue to use, that was more importantly of the best value proposition for them to be able to get the best out of the technology without spending, a ridiculous amount of money, but they could keep on coming in and getting treatments. We built 70 different exercise programs into the device so that they could treat with this device every month for a whole year, and they wouldn't repeat the same exercises over and over again.
That's amazing.
And that's how you create the correct technology that's going to amplify people's results, and that's going to be synergistic with what they're trying to accomplish in their life, in their gym, and their exercise routines.
So it's both aesthetic and functional.
Right, that's great. And a lot of patients may also complain about like back pain or having like a weak core. Would that help in that situation?
Yeah, so we just released what Pure Impact VIP, which is our standalone system, because actually the number one request that we had was, I want to do Sofwave on my face, and I want to do Pure Impact on my body, and I want to do it at the same time.
Me too, sign me up.
So we just released VIP, which is a nice little tablet that runs the Pure Impact, and you can do, your arms, your abs, and your quads while you're having your Sofwave done on your face. But what we did at the same time is we found that there was a lot of this kyphosis. It's a lot of this people on their phones like this, and they're rotating their shoulders back. So that gave myself and the R&D team the opportunity to add upper back, lower back for lower core, and really start to go beyond the typical aesthetic areas. So now we are able to treat arms, abs, quads, upper back, lower back, hamstrings, buttocks, and calves. So you've got a complete solution.
So who would you say is an ideal candidate for either of these treatments?
Well, the new look now is fit. Fit is in.
Right.
So, of course, there's a notion of prejuvenation, right? People want to prevent, and there are those of us of a certain age that want to regenerate. So, as a clinician, you're best to speak to who the ideal patient is, but we see a demographic, certainly people between the ages of 35 and 55 who want to really absolutely look their best, and Pilates is only taking them so far, and the like, and we think we can augment that.
Yeah, and I think an additional one is, which people don't think about, are post-surgical patients. Any type of surgical patient. You go and do hip replacement, orthopedic, or in our world, you go and get a facelift, deep plane facelift, or you go and get your breast augmentation or abdominoplasty or whatever. Most doctors, I know some are different, but most doctors will say, hey, I don't want you lifting anything for 6 weeks. And these are people that are going to the gym every day, and it's their mental state is that's how they get going.
Right.
So if we're able to use Pure Impact to provide them with the gap that they can do, is zero impact on that's going to affect their surgery, positive impact on giving their muscles prime, their endorphins, and everything like that. That's a whole other segment that we're also looking into.
And just a further comment on that, evidence in clinical study is important. We just completed a study on post-abdominoplasty with a very well-known plastic surgeon, and we've proved that the functional strength returns much faster through use of the Pure Impact. And so, the other comments to the audience is, Select your provider wisely. Certainly, you can't go wrong with an ASDS member. FDA clearances are important. In this business, people make a lot of claims with smoke and mirrors. And one thing I think has been the cornerstone of what we've done is we've made sure we did the scientific work, proved it, and have the appropriate FDA clearances.
Well, we appreciate that. And even with weight loss and patients that are thinner, they still have cellulite. Does Sofwave help cellulite at all?
So we are cleared for treatment of cellulite. I think cellulite, again, multifactorial, and you know this, you should never use a device in isolation. Right. The best way is to always combine different things. So people who are doing some subcision on some of those really deep, underpinnings for cellulite, you're going to want to still do that and pick your product of choice for that. I think from the purposes of bringing back elasticity to the tissue, building that collagen 3 and giving that smoothness to the tissue, that's what we're approved for, and that's what you would be using Sofwave for. Yeah. And of course, it wouldn't hurt to throw Pure Impact on there because circulation, as you know, is the most important thing to prevent cellulite, is to keep people's circulation in their extremities as good as possible. And by doing Pure Impact to affect the muscle, build the muscle, and get that localized increase in circulation, as well as using the Sofwave to rebuild and restructure the dermis, that's the 1-2 punch there.
Wonderful. Is there anything else you want to tell us about Sofwave solutions and GLP-1 patients, or just in general?
Well, I would say, in general, people are feeling better. We want them to look better. We want the quality of life to be enhanced. And the most important thing is to be sitting here with one of our early adopters in the Sofwave technology, and having the feeling that we delivered on our promise to have devices that work and are safe and take the state of the art forward.
Right. And what I've noticed is that patients really don't want surgery as much these days, so they're looking for non-invasive treatments that are effective with minimal to no downtime. And so Sofwave has been a really great addition in my practice for that, and I know my patients love it. So thank you for all your hard work and research and science, and thank you for being here today. Lou and James, it was an honor to speak with you today. And if any of you are interested in learning more about Sofwave and how it can help GLP-1 patients, or just if you're looking for tightening and firming, lifting, strengthening your muscles, you can find one of our ASDS board certified providers at asds.net/find. So thank you so much for joining us today, and we hope that you found it useful.
Thanks for tuning in to the True Skin Experts podcast. If you found today's episode helpful, be sure to subscribe and share with someone who might benefit. For more resources, or to find an ASDS board-certified dermatologist near you, visit asds.net and follow at ASDS-SkinMD on all social media platforms. Until next time, take care of your skin. It's with you for a lifetime.